we finished the testing, we printed the things out, we're showing the patient, maybe just that process and what that would sound like?
So as you can see, here's a report. So the report's broken into three different sections. You have your vascular assessment, your autonomic assessment, and your lifestyle assessment. All right. And since most of your patients are going to be neuropathy centered, the autonomic assessment is the most valuable. So we'll just go straight to that page. Each page has a different portion of the test with different markers. But really, we're looking for pseudomotor function analysis. And what this does is the real value for the diagnostic is that it's giving you a medical report about pseudomotor function, which is testing for small fiber neuropathy. And you have markers like real markers with empirical evidence from a waveform. The other thing that's very valuable about it is non-invasive. So, a lot of doctors will do nerve conduction studies, but that's, painful for the patient, and it requires more, it's more in depth. So and also you're not testing the small nerve fibers, which is important. The neuropathy will occur in the small fibers first. That's kind of the onset. So if you're testing those, then you're going to catch it a lot sooner. And this is what a reduced C fiber density looks like is it's basically either orange or red on here. You'll get yellow, which is borderline. It's trending that way. But essentially, this test right here would validate that the patient has neuropathy in their feet. It also shows microcirculation and nitric oxide peak, and that is an indication of insulin resistance. In terms of treating the diabetes that's causing diabetic neuropathy, if you know that the patient's insulin resistant, then that could go into the way that you're caring for the patient. The other thing that's very, very valuable is that oftentimes neuropathy symptoms are confused with peripheral vascular disease because they feel the same. Like if you're a patient and your feet hurt, they just hurt. You don't know, oh, that's neuropathic pain necessarily. So it behooves you, provider, to get a vascular marker, because not only can you catch peripheral vascular disease, which is a much more serious condition, acutely serious at least, but also when you're treating neuropathy, it's very important to have a full view of what's causing the neuropathy. And the two systems are interrelated. So your blood feeds the nerves. And so you want to get a marker for the vascular as well as endothelial, the health of the veins, in order to get a full picture of how to treat neuropathy. And so that's what the TM Flow provides. I mean, it's specifically designed for diagnosing neuropathy and giving a comprehensive look. So this page is for the ankle brachial index. I'm going to just make it a little bit smaller so you can see the whole page. This one's normal. So this patient's not at risk of peripheral vascular disease, which is good. And then you also have an endothelial page where, and this is what Dr. Kingsbury was referring to, because you're able to look, there's markers for inflammation, which is right here, the stress index. You have markers for the heart artery blood flow. You have your insulin resistant marker right here. And then you have vascular tone and a fibrinogen. So a couple of those markers are going to be useful when you're doing wellness examinations for the patients. And that again, could be a part of the scope of practice for, a chiropractic office if you guys are doing wellness planning. So those are kind of from a report, the points of value.
Okay. I guess when you're explaining to a patient with the numbers, can you give me kind of like an example on how you would talk? And I'm kind of wondering if this is kind of maybe more of maybe like a Dr. Kingsbury question even.
Well, what I would say, Dr. Kingsbury would say, okay, you've got your score 64%. We need to get it up to in the 80s. Right? That's kind of what he told me. Right. But really what you want to look at is you want to show, and this is very, very, very easy. Say, listen, this right here is peripheral distal neuropathy testing. It's a nerve conduction velocity study. We sent a small pulse of electricity into your foot to stimulate the sweat glands there. And what that does is it allows us to detect if there's any nerve damage. And nerve damage is a result of neuropathy. It means the nerve fibers are dying off. All right. And what we found is that there is reduced C fiber density. C fibers are nerve fibers. They're the small nerve fibers, and the density is reduced. It means it's not it's less dense, which means they're starting to die off, and that means that you're trending towards neuropathy. And so you'd be a good candidate for neuropathy treatment because we can measure this, and in the future we can improve it, and it'll hopefully relieve some of your pain. How did that sound?
Yeah, I mean, I think for me, it seems kind of simple.
And diagram right here that explains it. And then for anybody who's really like concerned with actual science, you have your markers right here. Let's see where it's the left sweat peak, right sweat peak. That gives the full range, right, and the amount. And then it actually shows the waves right here. Oh wait, here they are, right here. So it's coming in below those lines, and which means that the conductivity of the electricity is lower, right? So it's just showing that their feet aren't as the nerves aren't working as well in their feet, right? So you have the empirical data, you have the markers, you have the anecdotal explanation. This page right here will give you the evaluation for the doctor. Low sudomotor response in both feet. C fiber density moderately decreased. We suggest alpha lipoic acid supplement. Potential lab tests, vitamin B12, folate tests are suggested. So that's just what the software is programmed to say for small fiber neuropathy. You guys are going to treat it however you treat it, but that's what it says in the software.
Okay. So like this might be a silly question, but for the sweat peak test, does that change if the patient does the test right after, like for example, if they exercise? And
that's really, really that's not a silly question at all. There is a post-exercise option in the software. So that would lend me to think that potentially yes, right? So you would basically select that when you're doing the test.
okay, got
Yeah.
it. So even if they did come in from the gym and they did the test, and I would imagine the numbers were elevated, it would adjust automatically so that if they normally would be under that line, that like normal line, it should still show as under even after the exercise.
I can double check because I've really never been asked that question. But if my hunch is that if they have it programmed in with the software for a post exercise evaluation, then yeah, it would have compensating factors.
Right. Okay. Just okay. And then like for example, for the C fiber response,
Yeah.
can that ever be anything else other than neuropathy?
Well, you may have poor connectivity on the actual electrodes to the bottom of the foot. If they have like calluses or anything like that, that could potentially affect it.
Okay.
But in terms of like a chronic condition, not that I'm aware of.
Okay. So yeah, so if that's that neuropathy, 100%, nothing else, and we just have to get around calluses. Okay.
Yeah, if they have too many calluses, you can't run the report. That's
O-
the downside.
Okay. Let's see
But if they
here.
have a lot of calluses on their feet and they're complaining, like they're going to be a candidate already. Like you're not going to need to use the test to determine unless they're like, they have a job or something or like, some sort of physical condition that or some physical activity that causes that.
Okay. And if anything, we can still test through their hands though, right?
You can, but you're not going to get I can ask. I don't think you'll get a neuropathy reading that way. You might because honestly, when we do our testing of the software just before we run a test, just to make sure the software is working, we do use our hands. But I can ask about that for you.
Okay, every now and then we'll say, I have neuropathy in my hands, my feet are fine. They test fine in their feet. And usually more than likely it's probably something else. Honestly, it's usually their neck, but
Interesting.
yeah. Let's see. The let's see, microcirculation response. I'm not sure I put something here, but I don't know what I was trying to write. Are the tests like pretty consistent then? Like if you were like retesting right after, they have pretty strong
Yeah,
consistency.
here's the things that change. So these markers are going to be consistent. The ones that change are going to be your your cardiac autonomic assessment, because this is testing heart rate variability and exercise tolerance, and your response to breathing exercises. So these markers, like sometimes they're never exactly the same, because you're testing the heart rate, the speed at which the heart increases and decreases with a stress test, your deep breathing exercise, your blood oxygen saturation when you're sitting and standing. So that's not like always like exact, right? Now, if they have cardiac autonomic neuropathy, it's going to show every time. But these but the sympathetic and parasympathetic markers, they generally tend to be a little bit like, they change, from, if you were to test like 3 times in a row, they wouldn't always be the exact same. But
Okay.
your pseudomotor function analysis is going to be very, very close and similar. Your blood pressure too, that can change as well, right? But if you have blockage in your lower extremities, it's going to show up every time. It's not just going to be like, shows up once and then goes away.
Okay, that makes
Blood
sense.
pressure changes all the time.
Okay. And how would we handle someone like, right, like we're showing them these numbers and we're saying, hey, you have a problem here. It's you're heading towards the red, you're in the orange. That's not good. And I don't know if anyone ever has anyone kind of skeptical or, well, at that point, I think they would be skeptical of everything.
Yeah, you just say, hey, look, I mean, this is the only, empirical study. We're stimulating your small nerve fibers with electricity, and it's showing us that there's reduced density. They're dying off. Like, so, this is showing you that, like, this is the medical test for that.
Yeah.
If you want, we can take a nerve conduction study and basically take a biopsy of your foot. That'd be the next step.
Okay. And like without doing that though, this is like, is there like a percentage on how accurate this would be for, I guess if a neurologist after this test, they decided I want to still see a neurologist and do the testing, like, will the neurologist most like 99% most still likely say, yeah, peripheral neuropathy?
The neurologist is going to either want to run this themselves, or they'll try, one of the other, options available, neurological examination, blood test, an MRI, nerve conduction study, electromyogram, and a skin biopsy. And those are the options, right? So,
Mhm.
if they want to take it further, they can. The only issue is most of these don't test small nerve fibers, right? So they're going to go further up the chain in terms of the size of the blood vessel. And so we'll see how pronounced it is, right? If it's new, right, and it's just starting to happen for the small nerve fibers, then some of these other ones might not be fine-tuned enough to pick it up yet.
Okay. Okay. And that's kind of what I'm looking for. So talking to the patient, this is an advanced a diagnostic tool. It's able to detect early or do early detections of peripheral neuropathy by checking fibers, the small fibers that are unable to be checked until they get a lot worse, which is, traditionally the EKGs. No, not EKG. The other one, skin biopsy, and then the nerve conduction test. These ones are great, but that's when your neuropathy has advanced and it's starting to affect the larger fibers. This is going to detect it earlier while it's the most reversible. Is that kind of my marketing
Yeah,
angle?
absolutely. Now
Okay.
there's I'm going to send you a link. We have a ton of clinical studies on our website specifically about pseudomotor testing. So for you and Dr. Tilson, if you guys are really want to get into the nitty gritty of the science side of it, there's plenty of abstracts that are specifically address this type of testing and the medical efficacy.
Okay. Yeah, that would be great. He likes to nerd out on all that stuff.
Yeah, well, we have plenty of that, and a lot of doctors don't. So I always encourage it, because that just helps with the education process.
Yeah, no, he actually likes to he enjoys reading those kinds of studies and things like that. For me, I'm just trying to understand how I can, and that helped, like what we just talked about, that helped, that this is able to pick up the stuff that your neurologist most likely isn't going to, or until your neuropathy gets that much worse, why don't we handle this now? You already have it in your family, you have diabetes. Do you really want to risk that? So that's okay.
Yeah. And the email I sent you earlier before the Zoom, it has a good one page about pseudomotor testing. And it talks specifically kind of to chiropractors about what the options are that are out there and why pseudomotor testing is a viable option for your scope of practice. You know, specifically non-invasive, easy to administer, easy to understand, and high sensitivity, and early onset value. You know, you're gonna get people that are coming to you first, or at least second. Maybe they talk to their doctor and their doctor's like, well, you may have neuropathy. So they, you know, they would come to you guys because you're advertising those types of treatment packages. So really, I
Yeah.
mean, it's extreme value if you're going to charge a patient, you know, a substantial amount of money. It's good for them to know, hey, listen, this is a medical validation that you're spending your money wisely. You know, if this shows that you don't have neuropathy, then that's good, right? So it's also from a marketing perspective for you guys. You know, I don't know if you guys ever have any open houses or anything like that, but you could just advertise, hey, come do free neuropathy screening, and then that's just great lead gen. You know, you have people come down there and do it. Have your finance department there for, to pre-qualify people for the packages. And I mean, you really could set up a good system for marketing with it pretty easily.
Okay. Yeah, that sounds really good. If people are I guess paying out of pocket, do you happen to know what they average charge?
Oh, for a test? Yeah, I mean, listen, we've had doctors, you know, depending on your clientele. I don't know exactly your area, but you know, they'll charge the patient as much as they're getting reimbursed, you know, $350, $400 for a test. But some patients, you know, they don't want to spend that on a diagnostic. They'd spend that on a treatment because they actually reap the benefits. So oftentimes doctors will charge like $100, 150, or they bundle it, right? So, you know, what do you guys charge right now? Like 8,000? Yeah. So, you know, it's 8,150, 8,200. Because we have your initial diagnostic, or you know, you get the diagnostic at the beginning and then at the end. Yeah, so it's, you know, a couple $100. That's kind of average value.
Okay. Okay. That sounds actually really good. And if anything, we can always charge that and then take it off their final price if they go through the treatment or
I mean, I'm telling you, like it opened my eyes up when I met so many people at Epic that are like, you know, they're not integrated, right? Because we sell to so many different types of practices, and always I'd say probably like 60% of the conversations are really like, okay, what are the codes? How are they reimbursing? Are you sure they're going to get paid? Those are the questions that these doctors are asking. I go to the Epic and talk to all these chiros, and they're like, wait, no, we don't really need to get reimbursed for this because it helps us really, like, you know, with credibility and validation, you know.
yeah.
And that's huge. And then also on the top of it, if you guys do integrate down the line, it's a huge profit center just in and on itself.
Okay. I'm kind of starting to see some stuff too. We have our case managers that can probably do something like a free screening
That's what
and
I'm saying. Pre-screening will get people through the door.
yeah, and the doctor can pop in, just hello, but they're going to go with you. That way they're not spending too much time on these freebies. And then, okay, I'm starting to see. Okay, that sounds really good. And I'm just, I think the biggest thing right now is like Adam is looking more towards like, well, should I just get a therapy? Like a piece of equipment that's going to help them get the results, but it's really only for people who are like, I am desperate. I have, nowhere else to turn to. I'm hurting so much. And we our sign up rates for patients who are kind of in the middle, they're kind of starting. They know they have neuropathy, but they don't, it's just nothing more than like a nuisance to them. Those are the patients I really want to sign up on that we're kind of struggling with.
Yeah. So if you can give them a report that literally shows them,
Mm-hmm.
especially if it's like orange and red. When patients see red, that's the thing. Like, when we're talking to family practice, we usually say don't show the report to the patient right off the bat, just in case there is, things on there that need to be discussed, delicately. But in terms of marketing, if you have a report that you give to a patient and it's got a red or orange on it, like that's gonna psychologically be very powerful. We're just
Okay.
talking marketing. We're not talking about care and all that. I'm just talking about from.
Yeah, and the marketing part I think is good. Do the clinics that do the free tests, do they print them out like a report, like the whole report, or just sections
There's
of
a
it?
wellness report. Let me show you. That's good to give to the patients. So this shows again, C fiber response is in the orange. So they are having issues. It shows their full cardiometabolic score. It shows them that they're overweight. This one,
Mhm.
borderline endothelial function. And then it gives them wellness recommendations. So it's very easy to communicate to the patient with something like this,
Mhm.
not the other one. So there's not all this crazy markers on it. So this one's a wellness report also. It gives you a more comprehensive like wellness plan, gives you the markers again. So again, this has borderline inflammation. Let's see on here. You can customize this too. It might not have the marker for a pseudomotor, but we can customize that. Then it has all of your diet and exercise suggestions. I thought this might actually be more suitable for your what you guys are doing. This is more for wellness actually, but essentially, it gives a lot of very valuable lifestyle information for the patients, and so it's just the newest wellness report.
Okay, very cool.